Great. Thank you, Patty. And welcome, everybody. It's really exciting to be here participating in our first ever Patient and Family Day. I am here because I have a 14-year-old daughter, Sylvie, who had her first seizure when I was traveling on business in California just about 13 years ago. And Sylvie had a seizure, went to the hospital, was told to go back home, that it wasn't a big deal to have one seizure, had a second seizure that day, and wound up in status. I was able to fly back that night to find her in the hospital, still having seizures, having to have a spinal tap. Ultimately, the seizures resolved for the time being. She was in intensive care for another week, left the hospital on medication, but never has gotten control of her seizures. We went from medicine to one implanted medical device. We have had wonderful help from tremendously thoughtful doctors and nurses. And yet, for Sylvie, there has been no therapy that will control her seizures. And I came to learn fairly early in the game that Sylvie wasn't alone, that as many as a third of people with epilepsy have no therapy that will control their seizures, that probably half of those who find control live with side effects from the medications that are simply unacceptable. They cause chronic fatigue. Some of them slow down your ability to produce speech. There's a host of side effects that you all know too well that are more serious in character. And I was fortunate to come together with two other fathers of young girls with serious epilepsy, with our Dr. Orrin Davinsky, to try to do something to make a difference. And that has led to the birth of Epilepsy.com and of the Epilepsy Therapy Project. So it's really exciting a decade later that we have been very active in sponsoring new therapies and sponsoring meetings to sort of foster energy and dialogue among the community of researchers, of industry participants, and of parents and advocacy groups who are trying to move things forward in epilepsy. And over the last 2 days, we've focused on the Epilepsy Pipeline. And I want to tell you that we heard about 23 new therapies under development for epilepsy. There are a huge range of approaches, from gene therapy to new drugs to important new devices. There are devices awaiting approval. One of them, two of them ought to be out on the market today. We need to find a way to lend our voice to the FDA to indicate how serious epilepsy is, and the fact they can't. We have a device that's been approved in Europe for months and months that is just sitting at the FDA, not available to patients in the U.S., and it's simply unacceptable. But there is real hope in this pipeline. And one thing I want to bring to the patient community is the sense that the pipeline is hope, and it is theirs, and to get patients and families to be involved in supporting the development of these new therapies. Epilepsy Therapy Project has supported 10 of those 23 new therapies that we heard about. And so your dollars in support of the Epilepsy Therapy Project mean a great deal, too, in moving the ball forward and changing people's lives. I want now, quickly, if I can figure out how to work the slides.
Yep. Let me move it forward first.
Okay, with Patty's help. I generally depend on Patty's help. To acknowledge, first of all, our staff who's been involved in putting on the conference and today's meeting. Patty Schaefer organized the Patient and Family Day and has done a wonderful job. But we have a number of others who've been involved. I'm just going to mention their names quickly. They're on the slide here. There are others still, including, we have Priscilla Burton, our CEO, who I'd like to maybe acknowledge and have her stand. She's at the back, standing already. Makes it easier. And Kim Macher, our executive director, if she's not doing something to organize the conference, should be in the room. She may be outside dealing with last-minute issues. Heidi Morales, Crystal Jacobson, Marianne Brody, Bree DeVentern. I apologize where I mispronounce last names. Zoe, I'm going to mispronounce your name, Zoe, your last name, Zamgirbo, and Margaret Jacobs. And I also want to thank our wonderful faculty that we have here today, who you will get to meet shortly. I also want to acknowledge our sponsors. And David, I don't know if you can put up the sponsors slide or if I can find that. Here we go with more of the crew if I follow through. But, you know, we couldn't do this without our sponsors. In particular, today, Danny Dibb Foundation sponsored the SUDEP panel, and UCB also provided particular support for the Patient and Family Day. But there was a broad list, which you just saw, of folks who have helped make this possible. So thank you to Cyberonics, Synovian, Upshur Smith, Pfizer, Lundbeck, Medtronic, Supernus, UCB, Open Concept, and Neurovista. I also am just thrilled that we've had great support over the last 2 days and today from our friends and fellow travelers in the epilepsy advocacy community, and want to acknowledge and welcome some of those folks who are here with us today. Susan Axelrod from Kqed is here, has been a great supporter, as many board members from Kqed here. Jim Abrams from the Charlie Foundation is with us, which does incredibly important work on dietary therapy. We have Lisa Sobey from the Hope for Hypothalamic Hematomas Foundation. The Epilepsy Foundation nationally is here with us. And we have Joe Twist, who's head of research here. Epilepsy Foundation in Northern California. We have Andy Neff and Michael Scott here. The EPGP, Epilepsy Phenome Genome Project, is here and has a table. And if you have family members who, multiple family members affected by epilepsy, you should seek out that table. You can help move research forward, which is an important thing for everybody to think about trying to do. The Epilepsy Center of Excellence is here. And again, I mentioned Danny Dibb and Tom Stanton, their president. I've probably forgotten somebody, and I apologize for that. Remind me later. I'll be happy to and would love to mention that you're here. I also want to mention that yesterday morning we did an hour-long radio interview on epilepsy treatment and research with Kqed on the forum. And that is available on their website as a podcast. It was with Dave Iverson, Susan Axelrod, Dan Lowenstein, and Lisa Lindahl participated with me, and it was great fun, and I thought a great thing.